Are you waking up yet? I mean, it seems to me like a whole lot of people are still sleeping. And things are getting worse and worse and worse by the day. For instance, let's take a look what the leaders of New York think.
We have to be smarter about the way this is being done. The federal government has to prioritize the resources. Look at where the problems are across this nation. California has 2,800 cases. Washington State, 2,200 cases. Florida, 1,200 cases. Massachusetts, about 800 cases. New York has 25,000 cases. New York has 25,000 cases. It has 10 times the problem that California has. The increase in the number of cases continues unabated. As a matter of fact, the rate of increase has gone up. We have the most sophisticated people you can get doing projections on this. They've been studying projections from China, South Korea, Italy, places all across this country. And what they're now seeing is that the rate of cases, the rate of new infections, is doubling about every 3 days. That is a dramatic increase in the rate of infection. And this whole discussion all along has been, how fast does the rate of increase spread? And can we slow the rate of increase? We're not slowing it, and it is accelerating on its own. One of the forecasters said to me, we were looking at a freight train coming across the country. We're now looking at a bullet train because the numbers are going up that quickly. New York is the canary in the coal mine. New York is going first. We have the highest and the fastest rate of infection. What happens to New York is going to wind up happening to California and Washington State and Illinois. It's just a matter of time. We're just getting there first. Deal with the issue here. Deploy the resources, deploy the ventilators here in New York for our apex, and then after the apex passes here, once we're past that critical point, deploy the ventilators to the other parts of the country where they are needed. You know, ventilator is on average $20,000, $25,000 per ventilator. This is an expensive item. Nobody's going to build 40,000 ventilators unless they know someone is buying 40,000 ventilators. And that's what the federal government can give them with the DPA. I'd buy 40,000 ventilators. Caveat, they have to be here in 21 days. And then use them here. We hit the apex first. I will transport them anywhere you want in the country. I'm not asking you to give us 40,000 ventilators out of an item. Address the curve here, and then that curve is going to be going all across the country. You hear what I'm saying here today? You're going to have the governor of California several weeks from now saying the same thing. You're going to have the governor of Illinois saying the same thing. The governor of the state of Washington saying the same thing. Do it right here. We're just the first case. We're just the first template. Do it right here, and then we'll move the goods. I'll move the professionals. I'll move the doctors and the nurses who can say, we can teach you how to do this because we went through it. We saw this in New York. But the inescapable conclusion is that the rate of infection is going up. It is spiking. The apex is higher than we thought, and the apex is sooner than we thought. That is a bad combination of facts. So slow the spread. We'll still keep doing everything we can, but it is clear that we must dramatically increase the hospital capacity to meet that highest apex. And we have to do it very quickly. Again, the apex could be here in as little as 14 to 21 days.
Are you awake yet? Okay, we've got leaders of states begging for something to actually be done here, and it's not being done. What is it going to take? What's it going to take for you to wake up? You, yourself. What's it going to take for you to actually open your eyes one morning and look out and say, okay, something is definitely not going to be right for a long time here. I should probably get things in order and actually do some kind of measures of protecting myself and my family and others. What's it going to take? It's pretty bad already. Here's some more.
The great fear is if we don't get our response to coronavirus right, Australia could experience the hell Italy is currently enduring. With around 50,000 confirmed cases and more deaths than any other country, including China, Italy's health system simply can't cope. The Italian poet Dante described 9 circles of hell, each worse than the last. Today, Italy is living through them.
You don't know what's going to happen tomorrow and the day after, but you know that it's going to be worse than the day before.
Our cameras are allowed access to the very front line of the coronavirus catastrophe. This is the nightmare facing our health system if the pandemic takes hold.
If what happens here in Lombardy spreads to the entire world with the same speed and the same violence, we can expect more deaths than during the Second World War.
Professor Giacomo Grasselli is an intensive care specialist, coordinating all the IC units in hospitals across Lombardy, ground zero of Italy's exponential outbreak.
I think that here in Lombardy we had something similar to what happened in Wuhan, and that it was just the explosion of a bomb. And then from there on, the disease spread very quickly, and if it happens like that, it's impossible to stop. It's an incredible number. They are like the tip of an iceberg.
It sounds like a living hell when you walk through your intensive care units. I mean, how are you feeling?
Well, you know, it's an incredible stress for the healthcare system. And believe me, the healthcare system here in Lombardy is quite well organized. I mean, Lombardy is a very rich region. But still, despite all this, if the disease keeps spreading with this speed, we will get to a point where the number of beds in the ICU will not be enough for the number of patients requiring ICU admission. And we and you absolutely have to avoid to get to that point, because otherwise we will certainly get to a point where people will die at home because we will never be able to help them.
4 weeks ago, the state of Lombardy had 750 ICU beds, comparable with most Western countries. Now they have upwards of 3,000 coronavirus patients needing those beds. It's a medical war zone.
Tutti i sistemi di protezione individuali, dispositivi di protezione individuale, quindi il camice, i calzari, la cuffia, i guanti che sono da cambiare rispetto a quelli che ha addosso, la mascherina chirurgica, gli occhiali protettivi.
Carla Mastrini is the intensive care coordinator at Cremona Hospital. Coronavirus patients are placed on their fronts while being ventilated, so gravity helps the oxygen get into their bloodstream. It's medical protocol for patients with acute pneumonia, but it's not working, and the staff don't know why.
Purtroppo qua da noi non abbiamo ancora visto nessuno risvegliarsi. Noi abbiamo bisogno di togliere il tubo a qualcuno e di vedere che qualcuno sta meglio, perché altrimenti non riusciamo ad andare avanti. Abbiamo bisogno di qualcosa che ci faccia capire che quello che stiamo facendo serve.
Australia is only weeks behind Italy on the pandemic timeline, but Professor Grasselli warns the difference between control and calamity can be days, if not hours.
Most of the countries in the world, in Australia, maybe still in the United States, Northern Europe, you are still in a phase where Probably the virus is around, is infected people, but the bomb has not exploded yet. So you are probably in the first phase before the bomb explodes.
And it is a bomb.
Yeah, in some way it's worse than a bomb because you don't know what's going to happen tomorrow and the day after, and you know it, but you know that it's going to be worse than the day before.
Even though Italy is totally locked down, Professor Grasselli worries that Italians are still tempted to break their home isolation, and that would be devastating.
Now spring is coming here. The weather is beautiful, temperature is nice, so people want to go around. It's normal after winter, but they have to understand that it's like a collective suicide.
In Cremona Hospital alone, of the 1,000 people admitted, more than 100 have died.
Tanti decessi. E questo ci fa morire perché pensiamo di non riuscire a fare quello che siamo qua per fare, curare la gente e farla star meglio. E in realtà noi la vediamo morire, questo ci fa morire anche noi.
The ultimate horror will come to Italy if coronavirus hits the country's largest northern city, Milan.
Dico che noi siamo impotenti davanti a questa situazione.
Cremona Hospital intensive care nurse Simona Tomasoni.
È vero, noi siamo operatori abituati ad avere pazienti gravi in fin di vita, ci crediamo molto, ma questo susseguirsi così repentino di pazienti in pericolo di vita non siamo abituati nemmeno noi. È dura per tutti.
Are you at a point where you're having to decide in the worst possible way who lives and who dies?
We are not at that point yet, but I want to warn everyone that if we don't stop this, not only here in Lombardy, but in the nearby Italian regions, in Europe and in the world, we will all have to make those decisions. Because the load of patients on the healthcare system is so huge that no healthcare system, again, no matter how potent, powerful, modern it is, can sustain it. Since the number of carriers is so huge, then those absolute numbers become impossible to sustain.
Remember, this is an advanced Western country, just like Australia, now frantically building temporary intensive care units in hospital grounds. And in all hospitals, including Cremona, new ICU beds are being rushed in to try and cope with the epidemic.
Sente questo rumore?
Come?
Vedi il rumore?
Sì, cos'è?
È l'ossigeno.
40 anni che faccio il medico e non ho mai visto una cosa del genere.
Head of pulmonology at Cremona, Giancarlo Bossio, is getting by on a few hours sleep a night fighting this war. He says while the elderly have been dying in their hundreds, more and more young people are succumbing to the virus.
Purtroppo c'è una mortalità significativa. Colpisce purtroppo, ahimè, solo le persone anziane. Abbiamo avuto anche un 23enne.
The toll on health workers here, now in their fourth week of this terrible battle against an invisible enemy, is crushing.
A casa ci vado qualche ora di sera, dove muoio sul divano e sprofondo in un sonno che non è sonno perché mi sveglio ogni ora con gli incubi. Mi aspettano mio marito e mia figlia che mi parlano e io non li ascolto. Loro mi chiedono se li sto ascoltando, ma io non li sento. Ed è terribile.
Professor, how do you see this ending?
Well, I'm sure that this will end. This will certainly end with the vaccination. And I'm sure that now no-vax people will take the shot anyway. But it will end with many deaths. And I think that the world will never be the same, will not be the same after this. The world will change. Healthcare systems will change after this. Hospitals will change. Because we're certainly going to have new pandemics. This is not the only one we will see in our life. And that will be the biggest lesson we will learn from this nightmare which is happening here.
Hello, I'm Tara Brown. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.
I just don't get it. I don't understand what people don't see. I'm still walking around out in public, seeing people without masks in areas where cases have happened. The hospital just a couple of blocks away has had cases. And there's still people walking around in this area without a mask on. At stores and stuff. Wow. Oh yeah, I'm touching my face. Well, I'm at home now. I've already sanitized myself here. Every time I come in the door, I sanitize myself. So that I don't bring anything into my home. You know? Gloves, mask, all that stuff's kept out there. People better start taking preparations in order to keep themselves and their families safe. If we all do that collectively, then we can beat this thing. But people need to wake up, okay? Here, check this out.
Every household should declare a state of emergency, get 3 months of food and necessary medications, whatever essential meds somebody might be on, and get ready to hunker down. Look, we're going to see probably over 1,000 deaths per day during the peak of this thing. That's not something we're prepared for.
Roughly 1 in 4 Americans are now being told, stay at home.
Tighten the valve. Tighten the valve more. If the number doesn't slow down, close the valve. We're closing the valve.
Schools, restaurants, businesses closing. Airports empty. Unemployment claims soaring. Congress working on a plan to send checks to millions of families. But how much and how soon?
We need help now. Now. Give us answers.
New cases and deaths spiking here at home.
This is one of the greatest emergencies our nation has faced in generations.
And around the world. Military vehicles needed to cart off the dead in Italy. Testing kits and medical protective gear still in short supply. Younger Americans being struck harder than expected. Many still ignoring social distancing pleas.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
President Trump changing his tone. For 2 months,
we have it totally under control.
We think we have it very well under control.
It's something that we have tremendous control over.
But now,
if you're talking about the virus, no, that's not under control for any place in the world.
The U.S. facing an invisible enemy with no end in sight.
Yeah, look, we're way behind the 8 ball. The signs were out there for 3 months. We've been watching what's happening in China. A study out of Harvard 3 weeks ago said that 40 to 70% of the U.S. population could get infected. But to be honest with you, what has Dr. Anthony Fauci been saying? He has been giving the most generic and vague recommendations, completely absent from what he has been saying on every network, and he's the doc that every network has on, has been no preparation details, no specifics.
Physician's assistant James Kai says he got the virus after attending a medical conference near Times Square. He's 32 with no underlying conditions.
They are surprised. It can be come out that bad so quickly, and I'm so young. I don't drink, I don't smoke.
Kai says his health is deteriorating. He's hospitalized in New Jersey.
Half of my lung is already pneumonia, not working, only half. So I don't know how much longer I have.
Buffalo, New York, where I live, about 5 miles outside of New York City, we've been having people come into my wife's hospital for 3 months now. However, because of the inaccuracy of the test, lack of testing, lack of willpower from authorities, from the hospital, from hospital staff, it's gone undetected, unnoticed in the public, untalked about by politicians, and it's now a global pandemic. Most countries in the world now have thousands of cases and hundreds of deaths. The CFR ranges anywhere from around 1% or less in South Korea to as high as 8% or higher in Iran and Italy. this isn't the flu like we've been told. This isn't low risk. The risk is high. The risk is high as hell. The death rate at this current moment is around 7%, and even the numbers that WHO are using state that it's a 13% death rate, but they're rounding down because they say there's more cases that are undetected. The bottom line is this is looking more like SARS-1 every day. It's looking deadlier and deadlier every day. No matter how you calculate the death rate, the infected, the R naught, the numbers are high. The lowest possible death rate is tens and tens and tens of times higher than the common flu. The R naught is anywhere from 7 to 50 in my opinion. A doctor or a lawyer in New York in a Jewish community, he infected about 50 other people just by himself, and that's where experts believe how the epidemic in New York State started. WHO was about 2 months too late to declare this a global pandemic. The world was so slow to react. The minute that I saw that dozens of people were being infected by an airborne bat virus in Wuhan, China, I knew that this was serious. Why didn't any world leaders outside of Singapore, Taiwan, possibly Japan, a few select countries in Asia, Germany, other than that, nobody's acted responsible. America had a stockpile of a decades-old masks that have expired. We only had 12 million N95 masks, and they all expired years ago. My wife is on the union at the hospital. They still haven't had a meeting about COVID-19, even though they've stopped doing surgeries at my wife's hospital, emptied out all the beds, and a surge of COVID-19 patients continues in Buffalo. The official figures in Buffalo are less than 100 people have it. My wife's hospital has a 265-person bed filled with people right now. That should tell you the true numbers of what's really going on. The leaders continue to make jokes about toilet paper. We haven't had toilet paper for 3 weeks in Buffalo with no signs of us getting any more. We don't have basic goods like canned goods, dried goods, spaghetti sauce. It's been nearly a month that basic goods are running out. We have some produce here and we have some food, but we have like hog's feet and generic products that you wouldn't normally eat. You won't find your favorite frozen pizza. You won't find your favorite loaf of bread because we don't have any here. But they're telling us it's low risk to relax, to not stockpile on food for a disease that could last a year or two. The more time goes on, it seems like this isn't just a granny killer. It seems like young and otherwise healthy people are dying. In countries like Italy and Iran, they have sports stars and they have politicians who have died. It seems to be affecting a wider group in society than just 80-year-olds. The lack of America's willpower to take this seriously is a joke. So here's what the shelves looked like about 3 weeks ago. We still had some water, but we were getting limited. And now here's what they've looked like for the last 2.5 weeks till current time. There's no medicine, there's no dry goods, there's no canned goods. There's mostly just some produce and some food. There's deli meat still, but deli meats and produce. There's no bread, there's no dried goods, there's no disposable plates, cups, things like that. There's no soap, there's no laundry detergent, there's no dish soap. And basic goods are drying up here. But we're told on these White House coronavirus group meetings on TV that there's toilet paper and don't worry, you don't need to stock up on food. Well, I'm in New York, close to the epicenter of this thing, and I'm telling you otherwise. The last month, basic goods are running out here and they're not being restocked. You need to refill your medicine, you need 3 months of food, and you need to get a mask for you and everyone in your family. Don't listen to the government, because this is going to get bad. It's going to get really, really bad before it gets better.
So are you saying that it is feasible, even likely, that in some parts of the United States you will see Lombardy-style mortality rates from this disease?
Yeah, I think that will be so.
So we don't know if you can actually get this again if you've already been infected, given that lack of data.
But wait, there's more. Yeah, that's right. There's more, okay? There's another virus coming out of China now, all right? Called the Hantavirus, all right? I know it sounds like I'm joking about something, but this is no joke. There is another virus coming out of China already, and that is killing people. It's an old virus, but it is now all of a sudden spiked in cases. Now, official reason that it's spiked in cases is that their immune system has been collectively as a whole and populace been lowered there. So it has allowed pathogens like this virus to be able to get in where it otherwise wouldn't have, which I don't know how that makes sense, because if you've already had a virus, you shouldn't be able to get it again, supposedly. So, the Hantavirus is now running wild in China and has already killed people and is now said to have been spreading for a few weeks now. So, what? Oh, you don't believe me? Here, watch this.
The pandemic is spreading and there's already a new scare from China. A new killer virus. It's called the Hantavirus. You must have seen it trending on social media today. The virus is old, but the concerns are new, and so is the death. We don't want to spread panic, but we must know the facts. What is going on in China? Global Times, the mouthpiece of the Chinese Communist Party, was the first to report about this virus, the Hantavirus as they're calling it. It said that one person from the Yunnan province of China died on a chartered bus today. This person was later tested positive for the Hantavirus. There are at least 32 people, there were 32 people on that bus, and they're all being tested for any possible infection. As I said, the virus is not new. One report says the coronavirus may have weakened the immune system of people, so those who survived the Wuhan virus are now more vulnerable to other strains. And that is why we are seeing cases like these. So what exactly is this virus and what causes it? The Center for Control of Disease and Prevention, the CDC, calls it the Hantavirus. That is the full name. The virus is spread mainly by rodents like rats, squirrels, and hamsters. How exactly do they spread the virus? Through droppings and saliva. If a person comes in contact with the excreta or saliva of rodents, then he or she can be infected. In some cases, even a bite by an infected animal can cause it. What are the symptoms? Fatigue, fever, muscle ache, dizziness, and coughing. These are some of the usual ones. They may vary. Is this virus fatal? Yes, it is. In fact, it is much more dangerous than the coronavirus. The Hantavirus has a mortality rate of 38%. 38. It's a very scary figure. What's even more worrying is the fact that this figure is entirely based on previously confirmed cases. And there weren't many cases in the past. So the short answer is, yes, it's fatal. Now, the most important question right now is this. Can the Hantavirus spread to humans? Even the World Health Organization does not have a proper answer to that. It says human-to-human transmission of the Hantavirus is under investigation, meaning they don't know for sure. It's best to be honest. They must also give the world assurance that if the Hantavirus explodes, they will not rely on what China is telling them. They will independently investigate. Because we need to remember what the WHO said about the Wuhan virus. The WHO said that there was no evidence of human-to-human transmission. And yet look where we are, 17,000 deaths and counting. And while the WHO investigates, they must also look at the name, Hantavirus. Do you know why it's called the Hantavirus? Because it originated near the Hantan River in South Korea. It's named after a place, a river. It's curious that nobody finds that racist. This is a story that we'll track. We just hope there's nothing to track here. The world is not ready for another wave.
To stay at home, protect our NHS.
27 million people watched the Prime Minister's decree last night. This morning in central London, signs of real impact. In Glasgow, too. The government is underlining the message with mass texting of the population. The instruction now to stay at home unless you're shopping for basic necessities, going for some daily exercise, have medical needs, are taking essential workers' children to school, or have unavoidable travel for work that can't be done from home. Construction workers among them, and allowed to travel to work by the government. They're supposed to keep 2 metres distance between each other on site. The Mayor of London was asked if they should be allowed to carry on working.
My view is no, and I made that point quite forcefully at yesterday's Cobra, and I made that point quite clearly to the Prime Minister. According to the government's advice, the answer is yes.
His concern that while many are avoiding the trains, there are still too many rush-hour commuters squeezing into a reduced train service. But many of those commuting today, it seems, are from other sectors.
I'm an interpreter, so I have to come in for hospital appointments and things like that.
I work in a bank. I'm IT support, so people working from home, so I support workers from home.
I have to go to work. I have to close my shop.
She runs a vaping shop with her husband. Today, like so many, shutting up shop with no idea when they'll be able to open it up again.
It's scary, to be honest. It's terrifying. This is our life. This is, where we pay our bills, where, how we get the money to pay our rent, to pay our bills, to buy our food.
West Midlands Police said they found it unbelievable that officers today had to break up a barbecue party as residents ignored the government's ban on gatherings. Police forces around the country seem to take different lines on how to interpret the new laws and wanted help from the government on what was expected of them.
As we work through over the next few days, the guidance, and there needs to be real clarity from government, and I know that that is being worked on to be very clear about all of the reasons that people can and can't be outside.
As of today, the Cabinet meets by teleconference, and the daily press conference is conducted in an empty room in Downing Street with journalists linked up from their offices. Amongst the questions today, what should individuals do if they're uncomfortable being ordered by their employers to turn up at non-essential work?
The advice is crystal clear: to go to work where that work can't be done at home.
And what should boyfriends, girlfriends do if they don't currently live together?
So if your two individuals, two halves of the couple, are currently in separate households, ideally they should stay in those households. The alternative might be that for quite a significant period going forward, they should just test the strength of their relationship and decide whether one wishes to be permanently resident in another household.
But there's people in the streets cuddling and they're just not taking it seriously. And see, at the end of the day, they've got to take it seriously, because if they don't, it's going to be worse.
In Scotland, the government is allowing only limited construction work to carry on. Other implementation may differ over time. Tonight, another stark image to remind the whole country why this is all necessary. The government has announced London's Excel Centre in the Docklands is to be turned into a 4,000-bed emergency hospital. The exhibition centre was the venue for the G20 summit, when world leaders tried to shore up the world's economy 11 years ago after the financial crash. Now the site for what is showing every sign of being a bigger economic shock, on top of human tragedy for many, with no clear end in sight.
Are you awake yet? Please, share this video with everyone you know. Get the information out there. Remember, we can make a difference, but we must speak up.